Greetings. Hello. Well, my friends, as you know, the hair, the skin, the blood, and the urine can reveal a lot about the health of a person. And so on tonight's video, we're going to be discussing one of the many lab tests that your doctor may order in order to help them to get a understanding of what's going on with your health, specifically your immune system and the activity of your lupus. And so that's what we're going to be discussing on tonight's video. But before we jump into tonight's video, let me first of all welcome you to another video brought to you by the Lupus and Support channel. And it's Sunday, you guys, the beginning of a new week. And on Sundays, I call it Shout Out Sundays. I like to give a shout out to a few people. I like to recognize some people that are pretty active with the channel. And so I have three people that I want to recognize on tonight. The first one is Letitia Small. Letitia, welcome to the community. Grace Earls. Grace, welcome, welcome, welcome. I appreciate having you. And last but not least, Doris James. Doris, welcome to the community. I hope that the information that I provide on the channel is something that you can take along with you, as you journey through, if you're on a lupus journey, as you go on this journey. Also, for all three of you, I appreciate you. I created this channel to bring about awareness, to educate and to encourage regarding the mysterious disease called lupus. This channel is growing in leaps and bounds, so you're in good company, and we are making an impact around the world regarding lupus, which is something that, that's what I wanted for this channel. But anyway, jumping into tonight's topic, one more thing before we jump into the topic at hand. If you have not joined the community of the Lupus and Support channel, please take a moment to like, subscribe, share the video, and leave a comment in the comment section below. I do read all of your comments. I appreciate them. If you have additional information on a topic that I discuss on one of my videos, please feel free to respectfully leave that in the comments section. If you have questions or if you have a topic that you want me to discuss on the Lupus and Support channel, leave that in the comment section below as well. Okay, so one of the many tests that your doctor may request for you is a CBC, which is a complete blood count. And what he's looking for in a complete blood count is your RBCs, which is your red blood cell count, and your WBCs, which is your white blood cell count. On tonight's video, for the purpose of this video, we'll be discussing the white blood cell count and the importance of that. And just to save words, I'm going to start referring to it as WBC, which stands for white blood cell count. And so what is the importance of the WBC? The WBC is very important regarding your immune system. And as lupus warriors, we have what we call, or what's defined as an autoimmune system disease, which means the immune system turns on itself, it attacks itself. And so our WBCs is our first line of defense. It's our fighters when it comes to fighting against foreign invaders, viruses, fungi, bacteria, different illnesses and diseases. The WBCs are our first line of defense. The WBC can tell a doctor whether your immune system is weak or strong. And so when they're ordering these lab tests, they're looking to see, if your WBCs fall within the normal range. And that normal range is anywhere between 4,000 to 11,000. Anything beneath 4,000 means that you have a low white blood cell count, which also the medical word for that is leukopenia. Leukopenia means low white blood cell count. And so for tonight's video, we're going to be discussing the correlation between lupus and leukopenia. Now, there are many diseases that reveal themselves, by showing up through leukopenia. And lupus is one of those such diseases. It shows up in the form of, a low white blood cell count. Again, autoimmune system disease. A low white blood cell count can be very concerning because if your white blood cell count or WBC is too low, it opens you up and it makes you vulnerable to many illnesses and diseases, and sometimes life-threatening, very serious infections. A true story that I want to share with you on tonight. I had a friend that had cancer, and every week this friend had to report for chemotherapy. And chemotherapy, as we know, is an autoimmune suppressing or suppressive type of therapy. And so every week prior to receiving chemotherapy, my friend would have to go for lab work. And what the oncologists, what the physicians were looking for, they were specifically looking that week was what was the status of the WBCs. And if the WBCs were too low, then chemotherapy for that week was canceled. Because again, chemotherapy suppresses the immune system, which means it's going to impact and lower the WBCs. If the WBCs are already too low and you put, chemotherapy on top of that, then that means that the person's immune system is going to be totally wiped out, which means they have no defense, no shield of defense. They could catch anything. They could walk out of the chemotherapy room, someone sneezes or coughs or whatever is in the air, and they're going to catch it just like that. There was no line of defense. And that could be very serious for a cancer patient or anyone that has a disease that already lowers the immune system, or if you're taking some sort of immunosuppressant drug, that can be very serious. And so I wanted to kind of paint a picture for you as to the importance of your WBC counts. And, if your doctor looks at your WBC counts and they're too low and they're concerned about that, then there are some steps that they can take to help you. There are some things that they can have you to do to build your white blood cell count back up to at least close to normal. Okay. And so that's how important your WBCs are. No immune system, it means you're open to everything. And we all know that germs and viruses, we're surrounded by that. And all day long, our immune system is fighting off foreign invaders. Well, if you don't have an immune system, if it's wiped out, that means there's nothing to fight off foreign invaders. You could get an infection, you could get a virus, you could get a bacteria infection. You could get several infections at the same time, which can be very serious. And so we don't want that. And again, as I mentioned before, early in the video, there are lots of diseases that, reveal themselves through leukopenia. And I have a list here of diseases that can cause, a low WBC or leukopenia. And the first one on the list is viral infections that disrupt the work of the bone marrow. Your white blood cells, some of them are produced in your bone marrow. Your white blood cells, they're produced, all over the body, but the main place is your bone marrow. And also your white blood cells are also inside of your connective tissue. And so a lot of times with lupus, when you were trying to find an accurate diagnosis, sometimes you may have been told that, oh, you have some sort of connective tissue disease going on. And that's because white blood cells they're all inside of your connective tissue. And so if it's low, it can appear as though you have some sort of a connective tissue disease or some sort of an autoimmune system disease that just needs to be narrowed down to pinpoint exactly what it is. And so here are some other diseases and conditions that can cause low WBC. Bone marrow disease or disorders, infections such as TB or HIV. TB is tuberculosis. Immune system conditions. Crohn's disease can show up as leukopenia. Malnutrition, can show up as a low WBC count. Colds and flu. The usage of steroids and certain other medications can lower your WBC. Stress lowers your white blood cell count. Alcohol consumption lowers your white blood cell count. Hepatitis can do the same thing. Sepsis is a serious one that can show up as leukopenia. Lyme disease, that can show up as leukopenia. And then last but not least, any type of, certain vitamin and mineral deficiencies can also show up in the form of leukopenia, low white blood cell count. And so this list is not all inclusive. I'm not a medical professional. This information is just what I've studied, and it's for educational and informational purposes only. Okay? If you need diagnosis for any type of disease, please consult a medical professional. Your primary care physician would be the first one. And so this is all I have for tonight. As I say at the end of every video, there is life after lupus. Also, that God loves you and He loves you with all of His heart. And He has a purpose, a plan, and a destiny that involves you showing up as you. So take care of yourselves, my friend. Stay safe, stay strong, stay encouraged, stay blessed. And I will talk to you all soon on the next video. Bye for now, my friends.